a two-year-old Afghan refugee child who died. So my name is Haritini Zainuddin. I'm a child activist and the co-founder for Yayasan Chow Kit. So Madhya's gift grew out of the work that we do here in Yayasan Chow Kit. So we've been working on trying to protect and provide services to children here in Chow Kit since 2005. So Madhya's gift is named after a two-year-old Afghan refugee child who died because she couldn't get medical health services, and she had to wait 5 months. She was rejected from every government hospital because she was diagnosed with pediatric cancer and was not allowed to be admitted to government hospitals. We had to beg one of the hospitals to allow her in, but by doing so, the parents had to waive the 50% discount that she was entitled to as a registered refugee so that she could enter. So she paid 100% more. And even after she got admitted 5 months later, and she went through a period of remission and rounds of chemotherapy, etc. and stuff, and still getting resettled to Australia, she died. Much of the work that we do is about helping mothers and families and the children access health services in local government, hospitals, or just medical services in general when they can't access government hospitals, so that they can get the help they need to be able to, get better. The wife was having triplets. They couldn't pay, so they went from hospital to hospital to hospital. By the time she was in the ambulance, the babies were being born, and because they were preemies, right, because they're small, one of the babies died. So now there was a dilemma for the father, who not only had to make sure that the wife and the two surviving babies had to be admitted to hospital, which they couldn't afford, he had to bury the baby that died. What can we help? So we help to facilitate paying for, with the burial, because burial is not free, and him actually digging the baby's own grave and burying him, and then having to pay the hospital bill, which was crazy expensive. It's over 60,000, and then getting them released and making sure that that they lived in a place that was clean and hygienic, because the problem with a lot of the babies is not when they're born or when they have the operations. It's what happens when they go home and their house is not clean. So that's when they get sick and die. We love to other the other child. This othering concept is just ridiculous, really. And they're like, oh, you're too liberal. I'm like, no, I'm not liberal. I'm just being a human being. That's what human beings think and should do. I'm like, where's your humanity and empathy? I was watching the kids outside and saying their Friday prayers, right? And I'm sitting here and thinking, right, you just listen to their voices and they're praying, huh? They're doing their Friday prayers. Can you tell which one is Malaysian and which is not? Why are we doing this? If you look at the children, can you tell which child is Malaysian or which is not? They're all saying the same prayers, breathing the same air. Why are we doing this? Because children were sleeping on the streets in Malaysia, and I thought that only happens in India. I was stupid and naive to think that only poor children lived abroad, that there were no poor children in Malaysia, because I came from a very sheltered background. So all of a sudden I see children sleeping on the streets, getting raped on the streets, and not having enough food, and coming to school and not going to school, going to school on their own, not going to school, parents getting kicked out of it. And I thought, how is this Malaysian? Malaysians don't do this. And then you have the social workers in government offices telling me to mind my own business. Why do I care about non-Malaysian children? I'm like, because they're children. What is wrong with you? The point is affordability and accessibility, which is about timing as well, right? We need to do it quick. Children are sick, children are dying. That's the number one thing. So what we need to do is to set up a system where within 24 to 48 hours of being screened, so we have a council, a committee that will decide whether the babies get helped or not. 'Cause I get lots of cases every day. Yeah? And then the committee will decide whether to help, and the money, so there has to be a deposit within 24 hours, has to happen within that 24 hours, the child has to be admitted within 48 hours, all that has to get done. So in terms of priorities, that has to happen first. So I have to raise a lot of money so that we can do the deposits, we can do the payments, we can do everything quickly just to save the lives of the children. And that's all I'm supposed to be doing. But like I said, it's very hard for me to know how to do it. But yeah, that's the priority. It's been good, but we need to push more. We need to do more because, like I said, if you have a 60,000 ringgit hospital bill, it's crazy. Don't forget maternal health delivery services for mothers who are pregnant is 3,800 per mother. Then you have milk, it's a lot. But you know what? If we had policies that worked, we don't have to pay that much. They can support, they can donate to YCK, to Yayasan Chow Kit, because it's under YCK for now, as it has been for a while. And then say Madhya's gift. Yeah.